about the right atrium. Now, the right atrium lies in the right upper chamber of the heart, receiving the venous blood from the whole body, pumping it into the right ventricle through the right atrioventricular or tricuspid opening. This is forming the right border, part of the upper border, sternocostal surface, and the base of the heart. External features: this chamber is elongated vertically, receiving the superior vena cava at the upper end and the inferior vena cava at the lower end. The upper end is prolonged to form the right auricle, as you can see over here. The auricle covers the root of the ascending aorta and partly overlaps the infundibulum of the right ventricle. Its margins are notched, as you can see, and the interior is sponge-like, which prevents the free flow of blood. Now, at the right border of the atrium, there is a shallow vertical groove which passes from the superior vena cava to the inferior vena cava. This groove is called the sulcus terminalis, and it is produced by the internal muscular ridge called the crista terminalis. The upper part of the sulcus contains the sinoatrial or the SA node, which acts as the pacemaker of the heart. The right atrioventricular groove separating the right atrium from the right ventricle. This is more or less vertical and lodges the right coronary artery and the small cardiac vein. Now, tributaries or inlets of the right atrium: we have the opening of the superior vena cava, inferior vena cava. This is a cut section showing the right atrium. The opening for the coronary sinus, the anterior cardiac veins, the vena cordae minimi or the Thibetian veins, and sometimes the right marginal vein, all open up into the right atrium. Now, the right atrioventricular orifice: blood passes out from the right atrium to the right atrioventricular or the tricuspid orifice and goes to the right ventricle. The tricuspid orifice is guarded by the tricuspid valve, which maintains the unidirectional flow of blood. The internal features of the right atrium: the interior of the right atrium can be divided into the following three parts, which in the next slide we'll see. Firstly, we have the smooth posterior part or the sinus venerum. Developmentally, it is derived from the right horn of the sinus venosus. Most of the tributaries, except the anterior cardiac veins, open into it. The superior vena cava opens at the upper end, and the inferior vena cava is opening at the lower end. Now, the opening of the inferior vena cava is guarded by this rudimentary valve of the inferior vena cava called the eustachian valve, and during embryonic life, this valve guided the inferior vena cava blood to the left atrium through foramen ovale. The coronary sinus, you can see, opens between the opening of the inferior vena cava and the superior vena between the opening of the inferior vena cava and the right atrioventricular orifice, as you can see over here. This opening is guarded by the valve of the coronary sinus or the Thibetian valve. The venae cordis minimi are numerous small veins present in the valves of all four chambers. They open into the right atrium through the small foramina. The intervenous tubercle of lower is a small projection which is scarcely visible on the posterior wall of the atrium, just below the opening of the superior vena cava. During embryonic life, it directed the superior vena cava blood to the right ventricle. Okay, you can see over here, this is the interior of the right atrium. This is the posterior smooth part which contains the opening of the superior vena cava and the inferior vena cava. Also, it was receiving the opening for the coronary sinus, right? This is the posterior part. Now, coming to the anterior part, or the pectinate part, which includes the auricle. This is the smooth venous component. Okay, opening of the superior vena cava, inferior vena cava. This is an open section, right? So this was the smooth posterior part, and this is the rough anterior part, or the pectinate part, called the including the auricle. Developmentally derived from the primitive atrial chamber. It presents a series of transverse muscular ridges called the musculi pectinati over here. Now, because of the presence of these transverse muscular ridges, this is also called the rough anterior part. Triangle of Koch. Here, this is the same triangle over here. This is the triangular area of the right atrium and bounded by, this is the triangle over here, base, opening of the coronary sinus. Superiorly, we have the tendon of Torado. Inferiorly, we have the attachment to the septal leaflet of tricuspid valve, and importance lies within the fact that it is an anatomical landmark for location of the atrioventricular node here during electrophysiological procedures like pacing or ablation. Here you can see this is the triangle, right? The base is formed by the opening of the coronary sinus. Then laterally we have the tendon of Rodaro, right? And then we have the inferiorly attachment to the tricuspid valve. Here the tricuspid valve. So this is the triangle used for in electrophysiological studies. Now, coming back to these musculi pectinati, they are arising basically from the crusta terminalis, running forward and downward, okay, towards the atrioventricular orifice, giving the appearance of a teeth in a comb. And in the auricle, these muscles are interconnected to form a reticular network. The third component is the interatrial septum. So let's see developmentally. It is derived from the septum primum and the septum secundum. This is the septum primum. This is the developing heart. Presents with the fossa ovalis. You can see septum primum growing towards the atrioventricular cushions. This is the foramen primum. This is the atrioventricular valve. This is the atrial section, and this is the ventricular section, right? So you can see the right horn of sinus venosus, which will give rise to the venous component, or the smooth posterior part. Now, like I mentioned, this interatrial septum between the two atria derive from the septum primum and the septum secundum. It presents with the fossa ovalis. It is a shallow saucer-shaped depression in the lower part, representing the site of the embryonic septum primum. The annulus ovalis, or the limbus, you can see the limbus. Fossa ovalis is a prominent margin of the fossa ovalis, representing the lower free edge of the septum secundum. It is distinct above and at the sides of the fossa ovalis, but deficient inferiorly. The anterior edge is continuous with the leaflet with the left end of the valve of the inferior vena cava, right? This is the inferior vena cava. Now, this is again the developing right atrium. You can see the superior vena cava, inferior vena cava opening into it, right? So the coronary sinus with the valve. This is the ventricular, and this is the atrioventricular valve. And here this is forming the foramen veil, so the septum primum, and this is the interatrial fold of the septum secundum. The remains of the foramen veil over here are occasionally present This is a small slit-like valvular opening between the upper part of the fossa and the limbus, which is normally occluded at birth but sometimes persistent. So before going ahead, I'd like to talk a little bit about how this interatrial septum is developing here. So this is week 1 where implantation has just occurred. After which week 2, second week of life, we have the implanted blastocyte uterine wall forming the primitive placenta. Then week 3, the primitive umbilical cord develops. You can see the primitive umbilical cord. And the 3-layered germ layers are formed: the endoderm, the mesoderm, and the ectoderm. Right. So the endoderm gives rise to the primitive intestinal tube, the mucous membranes, the glands, lung buds, urinary tract, yolk sac. The mesoderm, on the other hand, gives rise to the heart, vascular system, the dermis, subcutaneous tissue, muscles, skeleton, and the sex glands, lymph glands as well, kidneys, connective tissue, blood cells. Finally, ectoderm gives rise to the epidermis, hair, sebaceous glands, sweat glands, nervous system. Coming to the cardiac development, we have the fetal development, cardiogenesis. Initially, there are 2 heart tubes that are merging to form one tube. So a single tube begins to swell up and then develops further on anatomically. Right. So it starts to begin by week 3, right? After which here is the twisting and turning of the heart. This is called the dextral looping, right? After which you can see the chambers of the heart are placed. At times there is abnormal looping called the levo-looping. So this causes a change. Now week 4, you can see the atrial septum and the ventricular septum is going to form. Now the atrial septum basically is growing in layers. I mentioned about the septum primum and the septum secundum, and then we have the endocardial cushion between the atrium and the ventricles, right? This is the atrium, this is the ventricle. We have the endocardial cushions in the middle, which will form the tricuspid valve, the mitral valve, and a part of the atrial septum. Firstly, we see this is the septum primum growing, okay? After which, the septum primum. Then septum secundum grows parallelly to septum primum. Now they both have holes in them, as you can see here. This is in septum primum. So the blood is going to flow through this, and that is called the foramina vein, like this. Okay. As long as the pressure in the right atrium is more than the left atrium. Okay. So this is this valvular mechanism of how foramina vein is formed. Right. So secundum ASD, or the atrial septal defect, is opening in the middle of the atrial septum, right? That is called the atrial septal defect, in which a tiny hole is left in the septum primum. A primum atrial septal defect is an opening at the lower end, the tricuspid of the mitral valve, resulting with a problem in the growth of the endocardial cushion tissues. And defect over here is associated with a defect in the mitral valve as well as the tricuspid valve. Right? So the atrioventricular canal defect. This is the atrial septal defect and the ventricular septal defect. Now, The aorta and the pulmonary artery are developing from a single tubular structures, okay, called truncus arteriosus, and these two areas are thickened tissue projecting into the ventricles, right? So they are going to grow in size, and they are going to fuse to form the septum, which has a spiral course dividing the truncus into two vessels, aorta and the pulmonary artery. Okay. You can see this is the spiral septum. It is done spirally, right? So by the fifth week, the atria are completely separated, the left and the right. At this time, the ventricular septum is continues to develop. The muscular portion of the ventricular septum develops from the apex of the common ventricle, as you can see over here. The membranous septum develops from the endocardial cushions over here. Okay? That is how the ventricular septum is formed. So, coming to week 6 to 7, week 5, atrial septation is complete. Now, what happens in errors of ventricular septation? The muscular defects, they could be muscular defects, any portion of the muscular septum. Okay? The small defects that can close on their own. But then we have the membranous defects that are lying behind the septal leaflets of tricuspid valve. And then we have the subpulmonary defects called the conal septum deficiency. And we have the AV canal type defects with the endocardial cushion tissues. Right? Coming to the arch formation. Here. There are 6 pairs of branchial arteries, 1, 2, 3, 4, 5, 6. After which first, second and fifth disappear. The third aortic arch will form the common carotid and the internal. The final aortic arch in the proximal right subclavian artery as well.